To health matters, KMPDU, together with Boresha Maisha, an NGO tasked to support the national government's Big Four agenda, has jointly presented a petition to the National Assembly Health Committee to address certain core issues in the health sector. Dr. Masikorir with that report.
As Kenya strives to achieve universal health coverage by the year 2022, stakeholders in the health sector seem to have a prescription for this.
This petition actually talks about healthcare financing, human resources, and harmonization of law, if I were to divide them into three.
A lot of it is about health financing, just how do we move money better in the health sector to ensure that services then follow the money that is given by the taxpayers.
The petition seeks to have a County Government Amendment Bill 2018 that will enable counties to transfer its functions and powers, like Level 5 facilities, to the national government.
In the Schedule of Functions, Schedule 4, national referral health facilities are a function of the national government. The point we are making here is to elevate and designate the existing 11 Level 5 hospitals into regional referral and training hospitals to be managed by the national government. Once you use the word referral on a hospital, it then reverts to the national government, because under the Constitution, referral facilities are a function of the national government.
The comparison of the Kenyan health system with the Cuban system seems to justify the timing and the content of this petition.
I had around 3 days in Cuba. I didn't have a lot of time. But our experience, and we were with Honorable Martin Owino, and some of the senators were there. Governor Kuti was also there, part of the CS. I think as we present our report to Parliament, the problem is how we are managing our health system. And especially as we talk about taking some of the roles of back to the national government, Cuba since 1960s, they have managed to actually, I think they're the best in the management of their health system in the world through devolving and actually reaching to the person at the grassroots.
It is unnecessary to have gone to Cuba. The process was hasty. It did not have stakeholder engagement, and we as the Doctors Union and as doctors we have never been involved, and therefore we are waiting for that point that we will be involved.
The union says it has 1,800 medical officers not taken up by either county or national government, and a further 171 specialists, some whose specialities have been sought from Cuba.
Details about the specialists coming and what they are coming to do, I think the ministry will brief us when we go on 14th, because even ourselves, we don't have really the details on the specialists, and even what they are coming to do. But I can say we will be in the forefront to fight and make sure the specialists who are already in Kenya are utilized. I think that's our role, because we need to also make sure that they are well and fully utilized.
And whether the Cuban deal is value for money for the taxpayer?
I don't know the details about the Cuban. Mine was the interest to see how Cuba, they run their health system, their healthcare sector. So on the details about the doctors, I have no idea. I don't even know how many are coming.
As Kenyans await the 100 Cuban specialists whose exact role is still not officially public, this petition to reverse some county functions and powers, or the establishment of a health service commission to address human resource, is one to watch as each stakeholder tries to get the best slice of the cake. Dr. Masikorir, KTN News.